In the case of panic disorder, medication treatments usually involve antidepressant medications in order to give you some protection from the actual panic attacks long-lastingly. There are other classifications of medicines that work much more quickly to kind of keep the panic attacks at bay for very short periods of time. These medicines are effective, but they can be habit-forming, and so we'd only want to use those in cases where the distress is high and people need to keep functioning. We wouldn't want to keep you on those medications for very long typically. Now, behavior therapies and cognitive behavior therapies are also very effective, helping people understand the cycle of panic, because panic starts as a pretty non-threatening circumstance. While the symptoms of panic feel unusual and intense, they are not harmful. And yet a person may come to believe that they're harmful. Educating a person about panic and that these are not harmful, actually getting them used to the sensations. Sometimes clinicians will actually help you re-experience these sensations in an office setting so that you can re-experience them as safer. Then, of course, we want to help you go back to entering situations that one is associated with panic and perhaps been avoiding. We would do this in programmatic ways so that you can get back into these circumstances that you've been avoiding kind of in a gradual way, not throwing you into the deep end of the pool at all, but very gradually getting you back into situations. And sometimes the hallmark of treatment success is when one can actually experience some of the symptoms of panic but not want to flee or exit the situation. Remember, panic attacks are had by many people, but panic disorder is shared by a much smaller group of people. So learning how to have unusual feelings and sensations in your body without the avoidance behavior is the hallmark of effective cognitive behavioral treatment.